Dr. Singh, you can begin.
All right, great. Well, welcome everyone to another episode of our Spine Time webinars. Thank you all for joining us on this Wednesday evening, October 6th. I am looking at the participants group. I recognize a lot of names, so thank you all for joining us. Today's very exciting. We have a talk on integrative medicine. What is integrative medicine and how it could potentially help not only your spine condition, but your overall health and wellness. So we're very, very fortunate to have experts discussing this topic with us. You know, we want this to be as interactive as possible, so please post your questions in the chat. I will be monitoring that window, and we'll try to get to as many questions as we can. We'll keep the lecture portion at as minimal as possible, but please don't feel shy and post your questions accordingly. So just a little bit about us, if you don't know who we are. So we are the Weill Cornell Medicine Center for Comprehensive Spine Care. We are located here right on Midtown East on 59th and 2nd. And what we love about our center, it's multidisciplinary and comprehensive with specialists from neurology, pain management, spine surgery, rehabilitation medicine, physical therapists, complementary integrative health. So a bunch of different spokes on these gears to care for patients like yourselves, optimizing your function, minimizing your pain. And that's the goal of the Spine Center. So hopefully, if we have not already been part of your life, hopefully we can be in the future. So joining us today, Dr. Josh Weaver. Dr. Weaver is one of the co-directors of the Center for Comprehensive Spine Care. There he is, Dr. Weaver. Thank you for joining us. An assistant attending in neurology and part of NewYork-Presbyterian Hospital. And co-featuring is Dr. Juveria Abdullah. She is an assistant professor of clinical medicine, also at Weill Cornell and NewYork-Presbyterian, and an integral part of the Integrative Medicine Center. So we're going to learn a lot about both of those features. So thank you, Dr. Weaver, Dr. Abdullah, for joining us. I'll hand it over to Dr. Abdullah first, and we'll get started. Thank you.
Hi, everyone. Thank you, Dr. Singh, for having me here today. So let's get into it. What is integrative medicine? And the way I look at integrative medicine, the way we look at integrative medicine is that it is Western medicine plus other healing modalities based on evidence, and we combine that together to look at the patient from a holistic perspective. So what does that mean? We look at every part of your life, whether it's sleep, stressors, emotional well-being, your physical symptoms, the medications you're on, everything together to really focus on your overall health and well-being. One of the things I do want to clarify that is a little bit confusing for some people is that integrative medicine does not equal alternative medicine. So we work in conjunction with your primary care doctor and your specialist as a complementary part of medicine and not supposed to be an alternative or a substitute for those doctors and your care team. So that's something I just want to clarify because I think there's a lot of confusion around that. And we'll go a little bit more into how our approach is. So the integrative medicine approach at our clinic, the nice thing is we have longer visit times. So we have the luxury of seeing patients usually for an hour for the first visit, 30 minutes for follow-up, and we actually have really close follow-up. So the reason that is that when we talk about your whole life, that takes a lot of time. And we're talking about all parts of your life, including, like I said, like sleep, stressors, diet, and that takes time. So it's really, we really get to know our patients on a personal level very, very closely. We create individualized treatment plans. So it's not a one size fits all program. Everyone is different. Everyone has different problems, different parts of their life that they want to focus on. And so we really individualize and customize that plan. And we use a big team. So it's not just physicians. We have physicians in our group and we work very closely with those physicians, but we also have a nutritionist, an acupuncturist, a psychologist, a massage therapist, a fitness instructor. We have a mind-body instructor, and lots of other people, part of our team that help bring about care for our patients. And like I said, it's very close follow-up, and we also have video visits, telephone visits. We keep in touch via email. So sometimes even in between those visits, I have patients touch base just to let me know how their progress is going or if they need a little bit of a boost in terms of motivation. So we have some of those touch points in between. So you don't have to wait all the way to your next follow-up. If you have a question in between or you have a or we just want to know how things are going, we'll have touch points in between. And everything is evidence-based. So everything that we do is driven by studies and a lot of the lectures that we go to in integrative medicine. And so what we do is incorporate the latest research and bringing both that Western, Eastern, and other types of modalities in our care. So what is integrative medicine composed of? We kind of touched on this. So you have your integrative physician. We talked about the yoga, massage therapy, nutrition, psychology, acupuncture, and physical fitness, stress reduction, Reiki, and pastoral care. And I actually want to take a moment to talk about stress reduction because that's a huge part of integrative medicine. Like we talked about, it's a holistic perspective. So we believe the mind, body, spirit contributes to overall health, and stress reduction is a big part of it. So all patients, we sort of talk about that because stress is a big part, especially in the last year and a half with the pandemic. And so we offer mindfulness-based stress reduction classes. We have a biofeedback class. We have different meditation classes that we offer throughout the week. That's not just the mindfulness-based stress reduction course, and many, many different things that we help patients find what works for them in terms of stress reduction. And how can integrative medicine help with, your spine or back pain? So of course, stress management is a big component because, like we said, that can contribute to overall pain, and that pain can lead to stress. So that vicious cycle we start to break. But there's also a sleep component. So sleep plays a really, really important role in the perception and physical experience of pain. So when you're in a lot of pain, you can't really get good sleep. You're waking up every few hours, you're tossing and turning. That sort of fatigue and non-restorative sleep pattern can cause low energy, depressed mood, fatigue, and worsen the pain and worsen inflammation, because melatonin and sleep play a really important role in decreasing inflammation. So we really try to work on breaking that vicious cycle that happens with pain and back pain. So what we do is we identify the causes. Obviously, pain is one of them, but anxiety, your sleep environment, your sleep habits, and even diagnosing sleep apnea and things like that, and referring to get diagnosis of that, or even with a sleep specialist. We review a lot of the sleep hygiene techniques. And like I said, it's a personalized plan. So not everyone is going to be able to follow some of those techniques. And we really try to piece out, why is it that you can't, let's say, sleep at a certain time each day? Why is it that it's very difficult for you to get off of screens? And we really work on down to the details of what time you're falling asleep, what you're eating before you sleep. So it's very, very detailed. And in some cases, we talk about supplements. So there are several supplements for patients who don't want to be on sleeping medications, or really want to come off of benzodiazepines or Ambien or things like that, and want to do something more natural. Depending on their case, we provide guidance with supplement. And very soon, we're going to be offering cognitive behavioral therapy for insomnia, which has been found to be very effective with helping with sleep issues.
Dr. Can I ask you a question?
Yeah.
Well, certainly, at Weill Cornell, we are fortunate to have a comprehensive spine center and also a Center for Integrative Health. How do we identify patients? There's a lot of patients out there. There's about 100 people listening right now. If you're out there listening, how can the patient say to themselves, you know what, I think I would benefit from this service? What symptoms do you think they have, or maybe they're not getting the care they want, or their function's not improving with the spine center? How can we identify those patients saying, you know what, you would benefit from an integrative approach?
The way I look at it is everyone can benefit from integrative medicine. We see so many different types of patients. And if you want to improve your health, and it may not just be related to your spine, or you think that, you're seeing all your doctors and you're not getting really the benefit, but maybe nutrition is something that you're looking for, or sleep is an issue and you really want to work on that, or your stress levels are so high and you're on medications and maybe you're seeing a psychologist, but it's still really high and you really want to get down to the root cause of it, or how other modalities other than medication to help you focus on stress management, that would be the perfect patient. Or anyone who's really interested.
How can patients come see you? Do they have to go through, myself or Dr. Weaver, or can they contact the center directly?
No, they can contact the center directly, and you can even tell our secretaries what insurance you have, and you can even go on. You can Google me, and it'll come up with the Integrative Medicine website. You can click on the website, and it'll tell you what insurances we take. So we take all kinds of insurance, and we also take Medicare. So we take a lot of patients. So you can just call the clinic, and you can also, if you want, you can have your doctor put a referral in Epic, but it's not necessary. And I'll put the phone number in the chat when Dr. Weaver is talking.
Appreciate that.
Yeah, so going back to other things that we work on is a lot of people don't really realize that your nutrition can affect pain and it can affect your back pain. The International Association for the Study of Pain reported that they actually found a really strong correlation with patients who ate healthy that were less likely to have chronic spinal pain. And they also found that people with the lowest consumption of a heart healthy or Mediterranean diet or healthy diet or the healthy index diet had higher chances of having pain, chronic spinal pain specifically, actually. And that if you had higher fruit, whole grain intake, you actually had 20 to 26% lower likelihood of having spinal pain. And added sugars, I know everyone hears about how sugars can be bad for you. Well, there's another study, just another of the hundreds of studies that proves it. 49% increased odds of having chronic spinal pain. So what we do at Integrative Medicine, again, we really, really focus on an individualized plan. So what I have people do after the first session is to submit a 2-week food log that we review together. And it's not meant to be judgy at all. And we really, really try to find places where we can replace things. So we really look at like cultural preferences, food allergies, things you don't really like to eat. We actually help you experiment with certain foods depending on your preferences. So like I said, it's very personalized, and we try to find ways to incorporate those veggies and fruits, even if you don't like them. I promise you, I will find a way to make you like them. So that's really a key part here, and really increasing those omega-3s and fiber, which is a huge part of a healthy diet. And this is a picture. The last picture I put was of my dog sleeping, because that's the goal. I want all my patients to sleep as soundly as my dog. This picture is the goal, which is like when I go to the farmer's market, I try to get an array of all kinds of colors, and getting all the colors of fruits and veggies is really, really important because you get different phytonutrients from that. And we also do weight loss counseling for those who need it, especially of those who have back pain that's worsened by their weight. So we really work on that, and doing non-medicine treatments at first, and trying to get achievement of weight loss through dietary and lifestyle modifications and intermittent fasting and things like that.
Wonderful. Thank you so much. And Dr. Weaver, while you're going through your talk as well, I was wondering if you guys could share maybe a patient story or an experience that went through the Comprehensive Spine Center and you found some value in referring them to the Integrative Center for Health. And just tell us about what that patient experience was like.
Yeah, for sure. Thank you, Dr. Singh. And that was a really wonderful overview of integrative health, Dr. Abdullah. I really appreciate that. The Integrative Center that we have at Cornell is really fantastic. And as part of the Spine Center, I work as a neurologist there. I refer people to the Integrative Center quite a lot. I'll just, kind of to your point, Dr. Singh, I'll go back a little bit. When I started working at Cornell, I was actually working at Lower Manhattan Hospital doing kind of general neurology. But over the first few years, I sort of shifted gears into more spine and peripheral nerve related disorders and became more involved with the Spine Center. The last few years, I've been pretty extensively involved in the Spine Center now. And over the years, I've really had a number of patients, initially when I would treat them, conventional traditional medicine, we're sort of taught to treat the symptoms. People come in with neck pain, they come in with back pain. We know we have our armamentarium of medications and physical therapy that we just sort of throw at them. We say, try this, try that. But I started accumulating more and more patients where either they had trouble with medication, side effects, or other issues, or they worked, but not quite enough. And I needed more options, and people came to me with these options, saying, I'd like to try a supplement, or I'd like to try acupuncture, or I'd like to try meditation. What should I do? And I usually just said, yeah, go for it. And I didn't really know what the evidence was. It was a big gap in my education. I think probably a lot of our education, just in a healthcare system, our medical schools don't traditionally teach that kind of stuff very well. So I actually a couple of years ago or about 3 years ago now, I joined a fellowship program that was remote. I was able to work during, and I became board certified in integrative medicine, but it was a 2-year program to just learn and I'm assuming Dr. Abdullah did something very similar and did a fellowship training, right? Exactly. The people who work at the Integrative Center, are all board certified in this, but I really wanted to know more. And there is a lot of evidence to back up a lot of these other types of care that you can provide that does give you more of a holistic view on treatments. And that was one of the big things. I wanted to be able to provide those patients with real answers and say, well, this has been shown to work. This really hasn't. So really the focus is really, like Dr. Abdullah said, it's on healthcare goals, what your spiritual health, your emotional health, your social health, all of that ties in, to pain. And I think one thing our health system does really well is acute medication and acute therapies. We're really good at fixing a problem quickly. Chronic issues, chronic pain, and also preventive medicine, sort of preventing people from developing that pain in the first place, we do not do very well on. We're just not equipped to do that. And that's where I think integrative medicine is really wonderful in helping with those. So, there's a lot of different things that we can do. There's a lot of different types of therapies. Dr. Abdullah pretty much touched on all those things, so I'm not going to spend a lot of time, talking about that. But the idea is working with your own goals and your own preferences to create personalized care. And there's a lot of different areas that we can do that in. Medications are still a part of that. Conventional therapy is still a part of that. But there's a lot of other things out there that can be really useful. And if you go to the next slide, I just wanted to highlight that this really is evidence-based. The NIH, for instance, there are other areas where there's a lot of research in this, but NIH has an actual center for complementary and integrative health. And they do have a lot of information also for patients, and you can go in there and they actually go through the evidence of what works. And you can actually see there's evidence for acupuncture. This is for back pain, mindfulness-based stress reduction, progressive muscle relaxation, all of these things, there's evidence behind. And I'm more familiar with those things now that I've had that training. The Integrative Medicine Center is also obviously very familiar with that, plus a whole lot of other disorders. And they have all the resources, like they mentioned. They have, nutritionists and massage therapists and acupuncturists, and it's really great to have that as part of Cornell. So I think, like you mentioned, a particular patient, it's hard to say because I've had patients who have gone to integrative medicine, have done the MBSR, mindfulness-based stress reduction program that they offer, have done acupuncture, and I've had some patients really actually wean off some of their chronic opiate medication that they were on. They've been able to really have a better quality of life. Even if the pain doesn't go away entirely, they're still able to do more. And that's been really, really wonderful to see.
You nailed something, key to the training of physicians in this country. And we're really great at reacting to pathology. We spend a lot of time in pathophysiology learning, when you have liver disease, here's what you do. When you have pulmonary disease, but in preventative health, we have not done a great job in moving the needle and maybe preventing a lot of the pathologies we see in the clinic. How many times do we say, if you lose a little bit of weight, if you stop smoking, if you try some mindfulness, you're going to improve your overall wellness. Dr. Abdullah, you mentioned something about stress, and I think we undervalue how important stress management and being mindful and anxiety and all that stuff play, especially in New York City during COVID. Obviously, it was a very stressful last year and a half. Tell us a little bit about that kind of treatment protocol and algorithm that you use when you see patients and you recognize that stress and anxiety are really part of the problem.
Yeah, absolutely. So, like I mentioned before, stress plays a major role, and we sort of we kind of get used to this low level stress all the time and think it's no big deal. It's just, daily stress is what I hear from my patients. No, it's just daily stress. But daily stress is really taxing, because if you are stressed all the time and you can't bring your autonomic nervous system, which is what guides the fight or flight response and the relaxation response, if you can't keep a relaxed state for most of the time, then you're going to have the fight or flight response if you're stressed all the time. And that basically leads to something called cortisol. So when you get stressed, you have parts of your brain, it's called the hypothalamus, tells the pituitary then a signal and gives the signal to the adrenals, and your whole body is getting taxed. And the adrenals release something called cortisol. Cortisol is great if you're trying to run away from a lion, because it makes your heart rate go up, your blood pressure go up, you don't digest things. But the funny thing is that people who have chronic pain and stress also have digestive issues, because of course, when you're chronically stressed, your digestion, when you're trying to run away from a lion, you're not supposed to be digesting your food and go to the bathroom. So imagine being like that all the time. So what happens is initially, cortisol is great. It releases sugar from the inside of part of your organs, your liver and other areas, so that you can use that glucose for energy for running away. But then what happens is that you have all that glucose lying around. High stress can lead to cortisol, leads to inflammation of the joints, of the parts of your back that are already inflamed. That worsening inflammation leads to worsening pain. That also causes all kinds of things. It messes up your metabolism. It causes insulin resistance. It leads you to gain weight. So all kinds of downstream effects from chronic stress. And the daily stress, I mean, something we're getting used to living in New York and the tri-state area, but that's not really how we're supposed to be living all the time. So it is something, normalizing stress is not really a good thing, and trying to focus on how to be relaxed more times than not. And it takes work to do. It takes recognizing what stress is. A lot of times people don't recognize. So we work on recognizing when you are stressed and how to learn how to relax. And that is a hard thing, to learn how to relax. A lot of people, one thing I ask them is, what do you do on vacation? Because that tells me a lot about how someone relaxes, and how long does it take for you to feel fully relaxed on vacation? So that tells me their level of stress.
I'm laughing because
sorry, I just want to jump in there. I think that's actually an amazing point to bring up. I have so many patients who talk about stress or mood issues like anxiety or depression as if it's this thing outside of their body, or if it's this magical thing in their head that's just separate from the physical, but it's absolutely not. These are all biochemical processes that are going on in our brain and our body, and it absolutely makes changes over time, and that's part of the thing that I try to get people to understand, is that we need to treat these things just like we would pain. We have to work on it and have resources to try. We have resources that can actually help these sorts of things. And it actually often translates to improvement in the physical side of things when we do that. And really, really important, for people to go through those therapies.
You mentioned something that doesn't have much regulation, like the supplement industry. I believe that some supplements certainly work. I'm always learning from patients. They bring in a newspaper clipping or a Google search on the newest supplement, Osteo, Biflex, or something like that, all the way to the things that were very, very regulated, something like medical marijuana. Dr. Weaver, I know you are pretty well versed. We have discussed this through our podcast before on medical marijuana. How does that kind of fit into the algorithm, and maybe even cross paths with some of the integrative health treatment options?
So actually, just take a step back. There's actually a lot of integrative health that goes on in conventional medicine to some degree. It's not necessarily the same holistic viewpoint that we have, but there are a lot of doctors who will recommend certain areas. Even just biomechanical things like physical therapy and massage therapy and things like that. And I know a lot of doctors who will recommend acupuncture and things along those lines. The thing that integrative medicine does a little differently is that it really takes a step back and looks at the whole patient from the get-go, instead of just offering little bits of like menu offerings, from like different areas. Medical marijuana is definitely a non-conventional treatment, although it is becoming more and more widespread. And I would classify it as along with other herbal medications, herbal treatments and supplements. These things have the potential to be really beneficial. They also have the potential for side effects, just like medications do. And I'm really careful to go over those things when I discuss it with patients. We are learning more and more, and there is some evidence to back up medical marijuana for certain conditions. And chronic pain really is one of them, the one that I see most often, that I use it for. It is not for everyone, but I do think it has a place within medicine in general, but integrative medicine in particular. And I think it can help a lot of people.
Have you been successful or seen patients reduce or even come off some of their narcotic opioid medications by using medical marijuana?
Absolutely. I have patients who have really, some of them have cut down on the dose. Some of them have come off of it entirely. The flip side is I've also had patients who really don't like how they feel on it, and it's not for them. And so, that's okay. We have other things we can offer, but so it's not a panacea that's going to fix everything, but I do think it can be really useful for some people.
One of the things we talk a lot about in physiatry and rehabilitation medicine is mobility, right? Movement is medicine. We want patients to be active and functioning the way they want. And, some of the features that you guys discussed, or Dr. Abdullah, like Reiki or Tai Chi or Qigong or yoga, things like that. Can you talk a little bit about what your experience has been with patients using these treatments, and what does the evidence suggest on treating spine pain, or not just spine pain, any type of pain using these mobility measures?
Yeah. So first, definitely. So yoga is a big one. It's been really well studied in different types of pain, going from back pain to migraines to all kinds. So that there are several studies that show the benefit of it. And I think with any sort of physical activity, one, we want to make sure that you're cleared from your spine doctor that you're okay to do it. After that, then we really try an approach where we start slow. So I think people come in with this like goal of, I want to do 45 minutes daily and I want to be this like really, really healthy person. And that's actually can be really dangerous for you if you've never done physical, like very intense physical activity. So we try like a very slow ramp up. Qigong has been very effective for joint mobility and osteoarthritis. It can really help with anxiety. So it's just movement itself can really help release those endorphins, which help with mood and anxiety. So that's part of it, as well as just helping physically. Reiki is a little different. Reiki is an energy healing system. It's a little hard to study. So I think researchers have had a hard time because it really depends on the practitioner. The way people have studied and become Reiki practitioners varies. So like it's a Japanese form of energy medicine. And there are certain practitioners that like do it over a weekend and do a course of certification. And there's ones that study for 12 years. And then there's variability. That being said, there was a meta-analysis that was done back in 2014 in a journal of Pain Journal of Nursing. And that showed that there was some benefit from Reiki. I mean, it took several different, like lots of different studies that were done on it. And if you look at the individual studies, there were benefits. The way I look at Reiki, yes, there isn't like, it's really hard to have this like strong evidence that's like randomized control trials that we have for like cardiology drugs or like different modalities, but the harm is pretty minimal. I mean, there is this idea that if your Reiki therapist has like some sort of like, is not in a good energy state that day, it can be passed on to you. But other than, that's some of the idea behind some of the negative effects, but overall it's pretty minimal and harmless to try. And if there is benefit, and there's some studies that do show benefit, I encourage patients who are interested in that form to go for it.
There's all these patients come in and ask us about diet. And I love talking about nutrition and diet. I think that's one of the things that we don't stress enough in our comprehensive spine center, but certainly in medicine. And they always ask, what's the best diet? Is it the Mediterranean? Is it keto? Is it Atkins? Whatever. And, a lot of the study shows that it doesn't matter what diet you choose, as long as you're compliant with that program. That's what kind of most of the data suggests. How do patients really respond to this integrative approach? Some patients come in and say, I don't have an hour for a visit. I want in and out. I want the diagnosis. I want a plan. I got to get back to my bank. But how do patients, when you interact with them, really take in this, approach, say, listen, this is going to take time. It's a process. And what's the feedback that you've received from patients?
So I can start with that. I have seen patients who've had that approach where they come in and they just want to talk about this one thing, their one issue. And I sort of gauge, and then I will ask about what their goals are. And I think when you start talking about goals, that sort of changes how someone looks at the overall thing that they're coming for, right? Like I had a patient who came in and was like, I just want to get to sleep 8 hours a day because I need to be functional. I was like, okay, so what is your goal long-term? Is it just the sleep, or what is it affecting? And then we get into a longer conversation. Sometimes it doesn't happen. And I give them the choice and I tell them, this is how our practice works. This is what we, our philosophy. If you want to make a follow-up appointment, you can make up a follow-up appointment close in about 2 weeks to a month. And let's see if I'll give them one intervention, because I feel like when you give people too many things at a time, they can get very overwhelmed, or they're just like, oh, I'm not doing this, or get really discouraged. And I give them one, if you can do that on our follow-up, great. If you don't want to follow up and this is not for you, totally okay. I would say 8 out of 10 times that patient who came in with that one goal and didn't really want to spend all the time will make the follow-up. And so it's very interesting to see that, because there is a little bit of, I wouldn't say total denial about the other aspects that affect health. I think most people that come in have an understanding its effect, but it's really hard to discuss about some of these things that you never talk to a doctor about. And, I'm basically, it's the first time I'm meeting. So there is a little bit of vulnerability to it to discuss. You kind of know when your diet's not great, or that you've been staying up answering work emails till 1 a.m. and then you expect yourself to turn off and go to sleep, So there is a little bit of that. You sort of talk about it, they think about it over those 2 weeks to a month, and then they come back a little bit more open to talking about it. So that's how I usually just have a little bit of, I'll have a couple of plugins to let it brew, and then it sort of sinks in. In terms of diet, I agree. It is very frustrating to have all the South Beach diet, Atkins diet, paleo diet. And of course, as a physician, it's overwhelming to have all these patients already have all their ideas about diets and all the things they tried and failed. At Integrative, we really, really go for the anti-inflammatory diet, which is sort of very similar to the Mediterranean diet, mostly because a lot of the research shows that that's been, has the most health benefits. And to me, it's the least restrictive. So the way I look at it, if you're going to eat, you might as well get the most bang for your buck. So patients, we really try to focus on the things they like and have more of those, So when I look at a diet, if you're going to go on a really, really like a crash diet, yeah, if you want to lose weight to fit into a dress, yeah, perfect. If that's your goal. But if your goal is for longevity and health and feeling, not being tired and being able to focus at work and lose weight, then, you have to have a diet that is sustainable. And a lot of these diets are not. So I really try to encourage people off the crash diets and really have something that will give you weight loss or give you energy over long term that you do. So it's really omega-3s, fiber, vegetables, fruits, more of a plant-based, but I don't necessarily encourage vegan or certain diets. It depends on the situation. Some people don't have to be on a gluten-free diet. There's a lot of misconceptions about gluten-free diets. That being said, there are a lot of people who have celiac, non-gluten celiac, non-celiac gluten sensitivity. So it very much varies, and it depends on the story and the reason that people are coming in.
Just want to dovetail on that. That was really great. I agree. I actually, in my experience, most of the people who I'm doing more of an integrative focus on, since I'm not in the integrative center directly, they're actually very happy to spend more time. That's sort of the majority of people, because they're kind of fed up with conventional medicine up to that point, and they're really open to having more discussions and really working on these things. But you're right, there are some people who, they're just part of the healthcare system as it is, and they're used to quick in and out doctor visits, and even though they don't particularly like them, that's what they're used to. And so it does exactly like you said, you kind of, for people like that, you sort of work with them and you give them a little bit at a time and have them think about it. And it kind of opens up over time. That's basically what we do. I also, I think some really good points you made, Dr. Abdullah. I don't think that there's like one treatment or one diet that's just going to necessarily fix everything for everyone, and it has to be really personalized, and it needs to be, it needs to be in line with your preferences and cultural specificity. There are people who grew up with certain foods who want to have certain foods. And that's why I really like the idea of anti-inflammatory diets as a general term, instead of saying just Mediterranean for everyone. Well, not everyone's Mediterranean. Not everyone's used to that, So, and that's okay. You can still apply basic principles across many different diets and find one that works for that person. But there's really not a one size fits all for any of this stuff.
There's probably, folks listening, and at the Spine Center, certainly we see patients with different abilities, some that are ambulatory without a walker or a cane, and some that are largely wheelchair mobile, and suggesting to them, you need to be mobile. I already said it, mobility is medicine. Go do yoga, go do Pilates, try Qigong, try these things, and that might be daunting to them. So how do you kind of cater that or tailor the program to the individual who might not have upper arm strength or lower extremity mobility that can do yoga, like chair yoga and things like that? Dr. Abdullah, so how, when you see the patient, how do you kind of cater their program to their current functional status?
So we start with what they can do. So if I have a patient, I actually have had a few patients that come in a wheelchair and really have terrible back pain and can't get up. And if they do have some mobility in their upper arms, or let's say not even that much, we're going to start with finger and wrist exercises. We're just going to get started with some movement, because that might improve some ability to do something you like. Like I've had patients who like to knit, but they haven't moved in so long or haven't really been able to do stuff. So we just start with very, very simple, basic techniques and build. So I really, really start with baby steps, because I think that is daunting. If you have chronic pain, if you have had disabilities and just being told okay, we're going to do this yoga class. And you're like, wait a minute, what are you talking about? And that's disheartening. And that adds to this sort of emotional part of having a chronic illness or disability or something. So really working on the things you can do, working on those so that you're optimizing those and moving on to the next step. So if you can do some finger wrist movements, some forearm exercises, very, very light weights with like, even if it's just like a can of soup or something like that, then we're going to move on to shoulder exercises. Then we're going to move on to at the same time, I like to have people do acupuncture, because acupuncture can be very, very beneficial with helping the pain that's associated with being not being mobile for a long time, and having that as an adjunct to the physical parts, either physical therapy or exercises, is really, really powerful. So it works synergistically.
I'll dovetail on that too. There, just like you said, there's a lot of modalities that actually don't require a lot of physicality, right? So acupuncture is one of them, Reiki is one of them, meditation is one of them, mindfulness-based stress reduction is one of them. I mean, there's a lot out there that you don't necessarily need to have full mobility or really any mobility for some of them to be able to do. And I think the other big thing is it's also setting goals and expectations, right? So you have someone who's had a spinal cord injury and hasn't been able to use their legs for 20 years. You're not going to get them into a yoga class and have them running a marathon next week. That's not the expectation. I doubt they would expect that. But the point is, you take, small goals and say, by the end of this month, we want you to have better range of motion. We want you to have slightly reduced pain, whatever it may be for that person, and that's what you work on. And there's always modalities to do that for people who don't have full physicality or full mobility.
I'm a big fan of practicing what we preach, and we want to be representative of using these treatments that you guys have mentioned. So on a personal level, how do you guys maintain some mindfulness or self-awareness? So you don't get stressed out and bogged down by messages or our medical record or all these things, especially in New York City. So what are some strategies that you guys use in your own lives to really try to maintain some balance?
I'll tell you, in the fellowship program, there was a lot of self-care that was a part of the fellowship, which was actually really lovely. And I didn't realize it until I started doing it. Very necessary. I really think to these other points, who is eligible for integrative health? Literally everyone. That's patients, caregivers, everybody. I mean, we're all people and we all can use these things to reduce stress, and we all have stress. It really sneaks up on you how much it actually affects you. So I didn't really realize it until doing all of this. And now I do more regular meditation. It doesn't take long. It's a few minutes every day. I do more daily stretching. I work out more regularly over the last year than I ever have before. And it's small improvements that I've noted. It hasn't been anything very dramatic, but it's enough that actually over time has made me feel better. I can say this does not mean that I still don't get bogged down in my email inbox and my phone messages and all of those things that all the doctors have to deal with, but it's just being more equipped with tools to be able to recognize when those stressors are building up and being able to deal with those stressors. Because really it is a daily struggle that we all go through, and it's just a matter of being able to handle that. And I think these modalities really help.
So for me, actually, the reason I went into integrative medicine was because I had my own health issues. I had horrible migraines, and I sort of just would do what I did all those years. I was in residency, I was attending, I would just take Advil, move on with my day, drink more coffee, move on with my day. It was an awful cycle I was getting into, to the point that it was really getting in the way of my life and the quality of my life. And actually it was my non-medicine friends who really forced me to look into mindfulness-based stress reduction and acupuncture. And when I started to change my lifestyle, my diet, and all those things, before I got into integrative medicine, it made a world of a difference. I mean, I was able to get off medications. I was not taking Advil like it was candy. It changed my life. And so that experience led me to go into integrative medicine. And I was like, oh my God, there's an entire world of things that we can do for patients that we are not tapping into. And it was from my experience. Now, in the integrative fellowship that I did, that was also that, like Dr. Weaver said, is a huge part, is to recognize that we have, as practitioners, have to practice what we preach. And so the self-care part was very, very important. So right now what I do, it took me a while, but I do have a meditative practice in the morning. I do about 10 minutes when I first wake up. I don't look at my phone. huge mistake that I was doing, especially through the pandemic, was the news, and it's very anxiety provoking. So I found that, and I actually tested this on myself. And of course, this is the N of 1, but I had this issue when I was like, I spend a lot of time with my patients. So I try to like keep eye contact, especially with Zoom, it can be a little bit difficult. So I was like, had all these notes at the end of the day. And when I found that when I was meditating in the morning, I was so much more focused. So I was more efficient on how I wrote my notes. My notes would be done as soon as I was done with clinic. I probably only needed 30 minutes to just complete a few more things of the notes. So I was actually enjoying my life more by meditating in the morning and being focused. I changed my diet. So there was a lot in my diet that I had changed to help me with energy, because I thought, I'm just a doctor. I'm working in the hospital because I also do hospital medicine part-time. I work in the hospital. Oh my God, it's just that's why I'm tired. This is just life. No, it's not. Like, you're not supposed to be tired all the time, no matter what, and no matter how much sleep I got. So it really, like, changing my diet, changing the times I was eating, all those things really, really contribute. So I really focus on routines, which we forget as we grow up. Kids work so well on routines. And somehow when we all go to like high school or college or whatever it is, and life takes over and you live in New York where everything's open 24 hours, you forget routine really matters. And so I started to really focus on having routines, a morning routine, having my matcha in the morning. I got off coffee, having matcha, meditating, and having those 30 minutes for myself, because honestly, it made me way more productive in the day and helped with my fatigue.
You bring up a lot of points. For the past 18 months, I've been on this journey with working with Dr. Weaver and some of the members of the Integrative Health Center on a podcast, talking to professionals and experts on various health and wellness topics. And, I have 2 small kids, and we really stressed sleep routine and sleep hygiene and a program of, all right, 6, 7 p.m., let's start this process. Whereas when we become adults, we forget about that. I'm looking at my phone. There's a stat that says we pick up our phone 150 times a day. I mean, that's incredible if you think about it, but that's probably right. It's probably like every few minutes you pick up your phone, respond to a text, or thank God social media was canceled the last couple of days. But yeah, we pick it up a lot, and we're distracted, and we really don't have much time for ourselves. We're wrapping up here, and please, if you're out there, write your questions in the chat box so we can get to them. What are some of the common things that you see patients come into the Integrative Center in terms of their diet that you immediately say, let's try to eliminate this one thing? I know it's tough to answer, but what are some of the common things that you see? Let's take this out of your diet and see what happens over the next few weeks.
I would say added sugars and simple carbs. I would start there. Because the idea that you shouldn't be eating carbs is not great. That actually is not healthy. You should be eating complex carbs. So instead of and this can be cultural and a little bit of an issue, but we work on that. Okay. Like I am half Dominican and half Pakistani. I will tell you, one of the hardest things for me to get rid of was white rice. And so I actually found, it was like a transition. I would do half white rice, half bulgur wheat. And I actually love bulgur wheat. And the fluffy texture of it kind of replaced it for me. So, we find ways to like get rid of those simple carbs. And so simple carbs and sugar. So really paying attention to the labels. So you can think, like a certain kombucha is healthy, but if you look at the added sugar, it has a lot of them have a lot of added sugar. And there's a lot of these protein shakes that are really healthy and they have a lot of added sugar. So really being mindful to trying to keep added sugar to a minimal to almost none. And so really sticking to whole foods. If you're going to snack, it's, these like energy bars are not necessarily great either. They have a lot of hidden sugar, a lot of hidden things that are not great. You're better off eating a whole fruit, an apple, a banana, or whatever it is that you can tolerate over having an energy bar or chips or something else that is processed. So that's kind of the first thing I would say is if you can minimize your added sugar and you can change your simple carbs to complex carbs, that would be the first step for me, because it's really that sugar load and carb load that makes your pancreas work really hard when it gets that sugar load, that glucose load. You get this insulin spike, and then you get a glucose crash. So your body, you have less glucose relative to what you had before, and you feel really tired, and your body gets dramatic, and it's like, I'm dying. And it's like, I get hungry again in 30 minutes. Cause like relative to what your sugar was when you ate that big load, it thinks it's like in starvation mode when it's not. And it makes you more hungry in 30 minutes, which is why if you have a plain bagel, you'll notice you get hungry pretty quickly instead of having 2 hard-boiled eggs. So really, really trying to get rid of those simple carbs and eating complex carbs so that fullness lasts longer and you don't get those sugar, the spikes of insulin and the crashes in the blood glucose to make you feel fatigued.
I'll just add in really quick to that. Sorry, Dr. Singh. Someone's asking also, like, what's a good anti-inflammatory diet, right? So Dr. Abdullah had mentioned the Mediterranean diet, and I think that is a really excellent framework in terms to build around, and you can add in your specific foods, within that framework, and that's a pretty good way to go. I also would just caution, and I do caution people that don't try to become a different person tomorrow. If you decide to, switch your diet around, it's very, very difficult to all of a sudden, have this completely anti-inflammatory diet, do a complete 180 and expect it to stick. It's not going to. So actually making these little changes, looking at the framework, looking at the diet, thinking about what are these little things that you can change, that's key, because eventually every week you start changing a little bit more, you start feeling a little bit better and better. And then you want to make these changes. I still haven't gotten past the coffee stage yet. I still do a couple cups of coffee every day. So I'm very impressed that you did that. One day we'll get there, but baby steps.
Go ahead.
We're all on a journey together. I can't stop all the vices all at once, but as long as we're making the right direction. Go ahead, Dr. Abdullah.
Piggyback off of what Dr. Weaver said. One of the things I tell my patients to start with is don't, try to do all your meals like anti-inflammatory Mediterranean. I would just do breakfast. Do breakfast for a week. If you can just focus on breakfast being healthy, anti-inflammatory, not eating simple carbs and added sugars, you're gonna notice a difference, and you're gonna feel a little bit better, and you're gonna notice that you may have a little bit more energy in the morning and into that afternoon, and sort of like you get that afternoon lull after lunch. So then you can move on to lunch. If you've nailed breakfast for a week and you're eating healthy, you'll be able to move on to lunch, do that for a week, and then dinner. So I wouldn't tackle all three. And if breakfast is hard for you to do, pick one meal that's the easiest for you to tackle, and I would do that and focus on a week or two of just focusing on an anti-inflammatory diet. And some resources, the fellowship that I did is through Andrew Weill, and he has like several cookbooks on there that are pretty good for the anti-inflammatory diet that go into detail of like simple recipes. One that I use is called Fast Food, Good Food that I like. It's very simple recipes. A lot of them take less than 30 minutes to make. So that's a good reference for just some quick anti-inflammatory foods that you can use.
Just really quick, I'm going to add on that. Also, go easy on yourself. If you have a day where you cheat, quote unquote, it's not cheating. It's just, that was a day where you didn't need, the anti-inflammatory foods. You might not feel good the next day, but I think a lot of traps that people fall into is they say, oh, that's it. I failed. I can't do this. I can't stick to it. Just, that was that day, and whatever it was, try to recognize what the stressors were, and, just try it again the next day. I mean, that's all you can do,
It's all about self-love. Give yourself a break every once in a while. There's questions coming in through the chat about anti-inflammatory diets and contact information, and we will certainly share all that with all the registrants. I know some of the administrators are on this webinar, so we will be sure to share how to get in touch with Dr. Abdullah, how to get in touch with the Integrative Health Center. So don't be surprised, Dr. Abdullah, if you get very, very busy after this webinar. But thank you both. Thank you, Dr. Weaver. Thank you, Dr. Abdullah, for spending time with us today on the Spine Time webinar. It was very informative. I learned a lot today. I think our listeners and our guests did as well. So any closing remarks for the group on living your best life?
Take it one step at a time. That's all I got to say. Baby steps. That's how we really get to getting to our goals. So if you want to eat healthier or you want to start meditating, start with meditation 1 minute a day. Insight Timer is a free app. Don't pay for anything yet. Just go ahead and do the free things first and really do 1 minute a day and incrementally increase. Same thing. If you want to start doing exercise, start with a light walk, 10 minutes a day, 5 minutes a day. It's really about the consistency that's going to motivate you and give you that positive reinforcement when you feel better and you feel proud of yourself for doing it. That's really going to get you to reach those long-term goals. So I would say baby steps. And if you want a book on how to stick to habits, I like Atomic Habits by James Clear. It was one of the books I read on having habits stick.
Yeah, 100% agree with that. I would also say, what I said before, which is just practice self-love, allow yourself to make mistakes throughout the journey. It is a journey. It's a long-term thing. And there will be ups and downs. So you just have to be ready for that. But I actually do think if you stick with a lot of these types of therapies and lifestyle changes, it will really make a huge difference down the road. So you just got to keep that long-term goal in mind.
Excellent. Thank you both. Great information for everyone. And thank you to everyone who joined us today. I think we'll be back in 2 weeks for another topic with guests related to spine and overall health and wellness. So thank you for joining us on the Spine Time webinar, and good night, everyone. Take care.
Okay, thank you.
Thank you.